I worked in Birmingham for over 30 years in the same surgery right in the middle of Birmingham, working with people who use drugs and alcohol for the whole 30 years. And I was there when, along with my young patients in the area, when brown smoking heroin came flooding in the first time in the early 80s, and then crack cocaine came, and they taught me together how to make crack pipes out of Coca-Cola cans and Ventolin inhalers, and then HIV came, and again, I walked along with them. And today I'm going to talk a little bit about the GP's perspective on this, but also about drug-related deaths. I'm retired from GPing now, but I go into our local coroner's office every 2 months and leaf through all the inquests, because behind all the statistics, as we know, are real people and people's families and my ex-patients and part of my community. So I keep a database for the last 10 years of all the people who've died, and we do that in order to try and look for some patterns, to try and look what we could do differently. And as we've heard already this evening, what we've been doing isn't working, and the drug-related deaths are the highest they've ever been, despite a lot of good people working very hard. We're doing something wrong, and my belief is we need to do things very differently. So at the end, I'm going to talk about 3 ways to save taxpayers' money and also prevent future deaths. So let me just switch this on, and then I might be able to. Oh yes, this is the centre of Birmingham. My surgery is just to the south of this, and I as I say, I worked with people during 30 years and saw a lot of people do extremely well, and a lot of my ex-patients are now working and paying their taxes and getting on with their lives, and others have not been so lucky, have become ill or have died along the way. I'm remembering Thomas, who I knew as a young man. I'm telling you this story because part of the harm that happened to my patients was caused by our drug policy and caused actually by our policing methods, which we've heard from Neil. Thomas was, I remember, as a young man who just had a smoking heroin problem. He was living with his parents at the time, but he was shoplifting to pay for the drugs. And he ended up in prison on remand for shoplifting. And although he got out about 3 months later, when he came to see me, I'll never forget, his arms were covered with abscesses, and I still have a Polaroid that I took at the time because he'd been injecting heroin in the prison using shared needles. And we later realised that during that time he'd also caught hepatitis C. And through my drug database information collecting, I know that Thomas died a few years ago because of the hepatitis C, in fact, rather than because of the drugs. He had cirrhosis, and although he'd had treatment, it was too late for him. And again and again, I was walking through life with people who were getting better and getting their lives in order and coping with what had happened to them in their childhoods, and then the police, I'm afraid, would come, and somebody like Neil would come shivering and shaking, and my patients would be conned. I can remember another young man telling me how he and his 3 mates were conned into going and buying a bag of heroin on behalf of this little shivering fellow who said he'd just come down from Glasgow where he got dealers' debts and he needed their help because he knew nobody. And of course they were trying to get the bigger dealers, but as Neil's explained, my patients who were on the bottom line got caught up in this. They'd go into prison, all right, only on remand, and sometimes they'd get out fairly quickly, but they'd have lost their place on the housing queue. All the good work that we were doing had been set back. Often they'd got a criminal charge. They couldn't get work. The work the police were doing in those days seemed to be doing far more harm to my patients in the middle of Birmingham than the drugs themselves. Sorry, I'm pressing the wrong buttons. The drugs continued to flood in. This is the route where they seem to come straight to Birmingham, don't they, from Afghanistan. The Russians invaded Afghanistan and they needed money for tanks and guns and things, so they started sending heroin on the cannabis route. You'd think we could have put up a big net or something to catch them. We never have. We've been trying, we've heard, for 50 years. We're not going to succeed. And meanwhile, people are dying. But the conversations are changing around the world and even in this country. And I was at the Labour Party conference last September, a year ago, when Lord Faulkner stood up, and to my absolute amazement, because I wasn't expecting it, he said, "I want to apologise for supporting the war on drugs, we can see with shocking clarity it's been a tragic disaster. And he said that we should legalise and regulate all drugs, including heroin and cocaine, to take the market off the criminal gangsters who are killing thousands every year. And this message hasn't got everywhere. This is apparently what happens in Cardigain. I hope this isn't one of your front doors. But what a shame, a nice front door is being broken down. Again, for what purpose, and who is that going to help? One of the people around here who uses drugs, is that going to help them, their family? We've shown that it doesn't work. Somebody, shockingly, in Newcastle apparently uses cannabis. I mean, my police in Birmingham, they go around breaking into semi-detached houses and rushing around trying to find cannabis farms through helicopters and heat sources and things like that. This is ridiculous. This is crazy. Across Canada 12 months ago, we've heard they legally regulated recreational cannabis, and in many countries around the world. And we're missing a trick, and we're wasting money, and we're doing harm. This is not just around here. This struck me. Oh dear, sorry. Hang on. Last year, this echoes Neil's story. 200 years in prison for the people that they'd locked up in South Cumbria. And the chief inspector was honest enough to say that we disrupt individuals. Very, very soon after there's somebody to fill the void. We've heard that from Neil very vividly, and I saw it in Birmingham. The dealers were locked up, a new dealer was there. We can't deal with it that way. Meanwhile, while we talk about this, people are dying. This is the Office of National Statistics. I took this graph from their figures that came out in August this year, and I'm very sorry, this is very sad. This is the 3-year total of number of people who've died in this area, and as you can see, it's rising each year. This is an interesting fall. This is small numbers in this local small area, but it actually echoes the graph that you see for the whole of Wales, because I looked at that as well, where there's a dip here, and then it's rising since. And this could be because Wales, after Scotland, launched the naloxone plan. You've heard that naloxone is the antidote to heroin overdose, and Birmingham as a city, we followed suit. I followed Wales, actually. You could say, and I can't prove this, but some more people every year would have died if it hadn't been for the naloxone program in this area, which has saved many lives since we started in 2011. The same picture in Birmingham is even worse. I'm afraid this is the last 4 years in Birmingham. Last year, 97 people died in Birmingham, drug-related deaths. 2/3 of them had heroin or another opiate in their system. A third had cocaine in their system. Cocaine, which used to kill 2 or 3 people every year in Birmingham, now, last year, killed 30, was involved in the deaths of 30 people. Cocaine, the police informers, used to be 30 or 40% pure when people bought it. It's now 80, 90% pure. Nobody's told that to the people who are buying it, and more people are dying each year across England and I presume in this area as well. So what we're doing is not working. This is the Birmingham. This is my database for the last 10 years, and you'll see this is the total number of people, individuals with families and friends and communities affected for the rest of their lives, and this is the heroin death, and this is cocaine coming up from nowhere in recent years. So we need to be doing. It's not working. We know what works. We know what does reduce drug-related deaths. Don't let anybody tell you that methadone is part of the problem, because methadone and buprenorphine and being engaged with drug treatment services is part of the solution. We know that you're less likely to die if you get engaged with drug treatment services. You're less likely to catch viruses. You're less likely immediately to need to do crime. Your family is going to be better. You can go to college. You can get into work. You can get your life in order, and then you can be helped to come off it. There's no doubt at all that all the research and all the evidence assures us, and the Advisory Council on Misuse of Drugs, on how to, that's one of their top recommendations. We should be doing that more. We should be pouring the money we're wasting on doing things which don't work. Heroin-assisted treatment we've heard about for people who methadone doesn't suit. we've done that in England before. We need to do much more of it. Naloxone, the WHO is saying 90% of everybody who might be first on the scene of an overdose should have access to naloxone. I don't walk around the streets of Birmingham without a naloxone kit. We now have nasal naloxone, which anybody will eventually be able to acquire. At the moment, they're slightly more expensive than those other kits, cost £18 each. I mean, that's peanuts. I've got, a £20 note in my pocket now, but in fact, you're entitled to a prescription, and I think you can be trained to carry one at the end of this meeting and be part of the solution. I have colleagues and professionals across Birmingham. One of my colleagues was walking through a car park in Birmingham on the way back from the ballet with his pregnant wife when he saw somebody had collapsed, and he carries a naloxone kit everywhere he goes, and he used it to reverse that overdose while he waited for the ambulance to arrive, and his wife waited in the car. This is the shocking reality. We can almost all of these deaths are avoidable if we put more money and more effort into it. So how can we do that? Drug consumption rooms, you've heard mentioned, and if you want to know more about them, this is me and the wonderful Philippe Bonnet visiting K-Nerf in Geneva, which is a drug consumption room. 15 minutes of your time on YouTube. If you look up drug consumption rooms, the Geneva experience, you can see why we think we should have drug consumption rooms in Birmingham. We've been handing out needles and syringes across Birmingham for 25 years to people, saying, here's your free kit, it'll stop you from catching viruses and getting HIV. Off you go around the back of the canal or the back of the car park and inject your drugs there. And instead of that, we should be saying, here's your needles and syringes, come into my back room, inject your drugs there, and is there anything else we can help you with while you're here today? You're not ready to be helped today? Fine, come back tomorrow. It's simple. These rooms can be just a room with a wash hand basin and a kettle to make cups of tea. They don't need to be expensive. And it's stigma and pig-headedness, actually, and not looking at the evidence from around the world that prevents the UK from opening even simplest forms of drug consumption rooms where we could welcome people in off the streets. In Geneva, there's no needle litter. And in Birmingham, it's everywhere because we don't have those. So the solutions, I'm nearly finished. Kofi Annan died last year. This was his last report, Regulation, the Responsible Control of Drugs. This is about what Jane was talking about, the responsible, proper legal regulation of drugs, which I believe is the way we should be moving, and many countries around the world are moving, and the UK needs to follow quickly. Kofi Annan said, I believe that drugs have destroyed many lives, but wrong government policies have destroyed many more, and that's my experience as a GP in the middle of Birmingham. You can read this on the internet. It's not a difficult read, and it tells you how we could restructure the way we deal with drugs around the world to prevent these waste of life and waste of money. And the Transform 5 models that Jane described, I think, is the way to go. It's not rocket science, as she said. Here we have the cafes where you can drink coca tea. Here we have some licensed premises like the coffee bars in Amsterdam where adults can smoke cannabis if they want to, instead of going to the pub and drinking alcohol, which is much actually more physically harmful for them. They could go into a licensed retailer like they do across Canada, like they're going to in Luxembourg, like they do in many parts of the world, and buy cannabis for their own use. This would make it harder for young children to get hold of it, because the black market would disappear if we do this right. And then specialist pharmacists, as Jane said, could sell MDMA. We've got a million, more than a million. Even the government says people using cocaine. They don't know what strength they're buying. If they go into a licensed pharmacist, they can be told, give them some harm reduction advice, be told what they're buying. The MDMA from the festivals, I also volunteered with the Loop last summer, and I saw teenagers, bringing in pills to be tested, which were 3-4 times the strength of expected in an ecstasy tablet. And I saw one person who thought he bought ketamine, this lad, and after the testing I spoke to and said, it's not ketamine, it's actually chloroquine, which is a treatment for malaria. I said, well, the good news is you won't die of malaria tonight, but you won't get very... But this is nonsense. This is 500,000 people across the UK. We can't put them all in prison for wanting to buy ecstasy to enjoy their music. So we need proper harm reduction advice from specialist pharmacists. If you've got a problem with opiates, then you need me or somebody like me. You need a doctor, you need proper specialist advice, you need prescribed medication, you might need prescribed heroin. These things are not rocket science. And if we do these three things, then we can pay for all that easily. If we first move drug policy from the Home Office to the Department of Health. Portugal did this almost 20 years ago, is it? And the sky has not fallen in. They poured the money, they decriminalised possession of all drugs for personal use. Many other countries have done this. The UK is behind the times. You stop locking people up, you stop spending hours of police time running around making criminal records for people, and you pour the money instead into health and social care. And then on the third week, you could start to work towards strict legal regulation of all drugs, starting with cannabis and learning from the good things and the bad things that we've seen across America. And that way, we can stop wasting money, stop causing harm, and we can prevent future deaths. Thank you.